All right, here we go. I'm Dr. Chris Nelson, and I've got two special guests on this very important YouTube video. We're here at Seattle Study Club, the end of day 3 before we have a little get together. And I just wanted to ask a couple questions, but first I'm gonna let you guys just very briefly introduce yourself, and then we'll get to the questions. So Jared.
Sure, yeah. Hi, I'm Jared Holloway, and I work as an orthodontist, originally from Utah, and enjoying my time here with my friends.
Yeah, right on, right on.
Yeah, and I'm Eric Stratton, general practitioner in Redding, California with Chris.
Yep.
And we've been having a pretty good time here.
Yep. Yep. Right on. Well, thanks for being on the show. And so basically the question I want to ask, the theme of the Seattle Study Club Symposium 2025 is the future of dentistry, and themes surrounding the future of dentistry. So the question, and I asked the same question to my dad on the beach a few minutes ago. So the question is, what do you guys think the future of dentistry is for you? What is your vision of that? That's the first question. And then I might have a follow-up, but we'll see how long we go on that. So what do you think? And either of you can start. I'm going to pass the mic. What do you think the future of dentistry is from your perspective?
Well,
hold that up a little.
Okay. Yeah. So, well, the big topic here was obviously AI. It's a huge piece to what's coming and what's already here. It's like scarily here already. I would say, implementing it in as many creative ways as we can. Everything from, how we create protocols for our staff to, I've already made like an evaluation for one of my staff members, and it came up with something in 5 minutes that would have taken me. I would have never come up with something as creative and as constructive as the AI did with ChatGPT 4. So really excited about that. Saves me time, makes me a more effective leader. So love that.
Okay, that's a good answer.
Yeah, like you said, Eric, there's a lot of technology that they're bringing that's going to bring a lot more information. And so I feel like the key to providing the, care for not just the smile or the mouth, but, the entire body and health is going to be taking that information and integrating into what we do day to day. As an orthodontist, I deal with a lot of kids. And so for me, more information, especially if it can increase that collaboration with healthcare providers, and other specialists, it's going to be a game changer as far as, early intervention when needed and seeing if we can prevent future health problems down the road.
All right. I like both of those answers. And it just started raining, which is great for all of the equipment. Yeah. Florida. It was supposed to be, I brought bathing suits and all this stuff, and it's like too cold. Yeah.
It is way too cold.
So, okay. Second follow-up question is what has been most inspirational for you? Because I'll just say for me, I used the symposium as a jumping off point for the year. And I kind of latch on to things like if I find a case or a scenario where I think is really, really challenging, I usually draw inspiration. I think back to, I'm like, well, in symposium, I know that I've seen people do that. I know it's possible, or I've done it before. It might be scary, but I have a support group through the Seattle Study Club nationally and locally, but we could reach out to any of these speakers and ask them questions. So what is sticking, other than the AI and the patient care that we've discussed already? Like what is sticking with you? What do you think is going to be stuck in your head a month or two from now? And what will you draw inspiration from?
Well, so we went to the same last lecture. Was her name Katie Toe or something like that? Yeah. Dr. Toe. And she is so on it in terms of doing what our medical colleagues would really like to see out of us. She's A1C testing in-house. She's doing ozone to treat perio disease. She's using a microscope to look at the microbes and showing it to the patient so that she can say, I know that the ozone worked or it didn't, or the therapy. And she's even doing perio maintenances at 30-day intervals because she's getting the feedback from the microscope at whether or not it's working. I mean, the levels that these people are doing this at, it's inspiring, and it makes me want to be a better dentist. So,
Yeah.
Yeah.
For me, I would honestly say it's the connections.
yeah.
You know, I'm currently on a job hunt, and
There we go.
I've just found a lot of inspiration from members at the booth, other dentists yourselves, and just the level of love and care of like, hey, you know, what can we do to support you? And it's nice knowing that I'm not alone in it. And I feel like that's exactly what my patients want to hear, is that they're not alone in their health journey, because they know I got your back.
I like that a lot. You know, that last, I wasn't in the lecture that you were mentioning, but I was in a different lecture, and I just was thinking of the same thing about the beauty of organized dentistry in general, and specifically the Seattle Study Club at this event, is the support. And it is so fun to sit down, and nobody's name tag says what their initials are. It just says their name. And, you know, it says maybe presenter or director or, you know, speaker, that sort of thing. But everyone's so approachable, and it's really a safe feeling environment to share and to collaborate so that we can all be better. And ultimately, as we were talking off camera, like help our patients. Because at the end of the day, that's what we want to do, right?
Yeah.
Yeah. So
100%.
anyways, I want to thank you both for being interviewed. This is a no cut, no edit interview in the rain, in the cold. We were going to have a fun little party. It was supposed to be outside, but now it's going to be inside. Oh, you got to put on your hat because
Oh, yes.
There we
yeah.
go. That's the
Oh,
gift
here
they
we
gave
go.
us this year.
There we go. All right. What do you, any parting words, or you feel like we're good?
I think we're good.
Okay.
Yeah.
All
Thanks
right.
again for letting
Yeah.
us be part of it.
Sure.
Yeah. Thanks for sharing this channel with us.
Absolutely. There will be tens of views.
Tens of views. Hundreds of, maybe hundreds.
Oh, no, tens. Tens is more accurate. Okay. Thanks, guys.
All
right.
Fun.
All right.